And while people are relieved that most of them are benign, what are we doing? What
Yeah.
are we doing biopsying all these people that don't even need a biopsy? So we're saving them from unnecessary biopsies. And more importantly, we're saving them from unnecessary treatment because we are not putting those people in the system that don't need to be in the system. We are not treating them for breast cancer when they don't need to be treated for breast cancer. And we're saving their hearts and their brains and their bones and their skin and their gut and their libido and everything else.
Welcome to Suburban Warrior, the podcast that will impact, inspire, and empower you to transform your mindset and become the badass warrior that you are. I'm your host and fellow warrior, Chrissy Pfeiffer, former clinician and corporate marketing exec turned multi-passionate entrepreneur, performance and life coach, and mom to 4 not-so-little warriors. Each week, I will bring you honest conversations with inspiring guests to share their stories of resilience, optimism, success, and simple yet effective strategies so that you transform your thoughts and change your behavior to get the results you want in your life. You will be empowered to take action, warrior up, and believe in you. Let's do this.
What's up, warriors? Welcome back to another episode of the Suburban Warrior podcast. I am back this week with another amazing Suburban Warrior here to share with us her story and expertise. And I'm so excited today to say that she is a returning guest. She was here way back on episode 23. So if you guys haven't listened to that episode yet, definitely go back and listen because it was awesome. And we talked all things functional medicine. But I'm welcoming back to the podcast, Dr. Jenn Simmons. And she started her professional career as Philadelphia's first fellowship-trained breast surgeon and spent 17 years as Philadelphia's top breast surgeon. Her own illness led her to discover functional medicine. So enamored with the concept of creating health rather than killing disease, she left traditional medicine in 2019 and founded Real Health MD to help women along their breast cancer journey truly heal. Dr. Jenn is on a mission to change the impact of breast cancer by empowering millions of women to take control of their health and create the life they want. She hosts her weekly podcast, Keeping Abreast with Dr. Jenn, hosted the Breast Cancer Breakthrough Summit, is the author of The Smart Person's Guide to Breast Cancer, Recipes for Real Health, and the newly released Smart Women's Guide to Breast Cancer. Dr. Jenn is also currently opening Perfection imaging centers across the country featuring QT imaging, an innovative technology that uses sound waves to create a 3D reconstruction of the breast without pain, compression, or radiation. This fast, affordable, FDA-approved technology has 40 times the resolution of MRI and will forever change the way we screen for breast cancer. Welcome back to the podcast, Dr.
Thank
Jenn.
you. And I can go home now because you've said it all. I'm done.
And that's it. We're done. No, you're not getting off that easy because we have so much to talk about since you were on the podcast last because you are doing so many amazing things for women and for the world. I cannot wait to talk about the QT imaging centers that you're going to be opening, but let's just go back and start with those listeners who don't know about you and haven't listened to episode 23. Tell us a little bit about yourself.
Yeah. So I really found the breast cancer world very organically. I mean, there really wasn't a time in my life where I didn't know about breast cancer. It's been ever present and ever pervasive in my family. It's really part of the fabric of my family. So when I was growing up, I had a first cousin. Her name was Linda Creed, and Linda was a singer-songwriter in the 1970s and 1980s, and she wrote all the music for the Spinners and the Stylistics. So I'm really, really dating myself because most people don't know who that is. But she did write 54 hits in all, and her most famous song was The Greatest Love of All. Now, most people know that song. What they don't know is she wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali. But it really received its acclaim in March of 1986 when Whitney Houston would release that song to the world. And at that time, it would spend 14 weeks at the top of the charts.
Yeah.
Only my cousin Linda would never know, because Linda died of metastatic breast cancer just 1 month after Whitney released that song.
Wow.
Linda was my hero, and I was 16 years old when my hero died. Her life and ultimately her death gave birth to my life's purpose, because I never wanted another woman, another family, another community to have to suffer the way that mine suffered. And the truth is that when women die, especially die young, it has a profound effect on their community, because as women, we are givers, we are nurturers, we are part of the fabric of our communities. And when we're not there and when we leave abruptly, you don't have to be a famous singer-songwriter for it to have a significant impact. And I didn't want that to happen again. And so I did the only thing I knew how to do. I became a doctor. I became a surgeon. I became the first fellowship trained breast surgeon in Philadelphia. And I did that really well and for a really long time. All the while, because breast cancer was so pervasive in my family, for me, I never thought about if I would get breast cancer. I thought when I would get breast cancer. And I practiced long enough for my aunt to be diagnosed, for my mother to be diagnosed. And I was about 15 years into my practice. And at the time, I'm, running the surgery department, and I'm running the cancer program, and I'm a wife, and I'm a mother, and an athlete, a philanthropist, and I have all these balls in the air. And I'm feeling pretty invincible. And within a day, I went from someone who was probably one of the most high functioning individuals you will ever meet to I literally couldn't walk across the room because I didn't have the breath in my body.
Wow.
And I underwent this really intense 3-day workup. And at the end of those 3 days, I found myself sitting in the office of my friend and colleague and physician. And he tells me that I need surgery and chemoradiation. And, it's one thing when you say those words to someone else. And when those words are coming at you, no matter how many times you've heard them or how prepared you think you are to hear them, they rattle you to your core.
Yeah.
And I was lost in an out-of-body experience. And the only voice that I could hear over and over again was, there's something else, go find it. There's something else, go find it. And I refused treatment. And I walked out of the office that day with my friend telling me, Jen, if you don't treat this, you're going to die of your disease. And it's not that I didn't believe him or think that he wasn't telling me the right thing or think that he was ill-advising me, because this was the standard of care. And I knew the standard of care. I mean, I'm a cancer doctor running a cancer program. I know the standard of care. But that something told me that there was something else. And so I went on a journey, a very selfish journey. Like, this was no longer about how I'm going to help the world. This was about, how am I going to live? I have 2 small children. I'm not done being a mom yet. I'm not done being a doctor yet. Like, my life wasn't cooked yet. I wasn't ready. So I was trying to figure out, and also it was the first time that, patients, that's the first question. Why did I get breast cancer? Always their first question, why? And we had this kind of cooked up answer where, oh, it's multifactorial and it's not one thing. And it's not one thing. And it is multifactorial, but we never got to answering that question for people, right? Like, we treated it more like it was your bad luck than anything else. And I don't want to say that this is about anything that anyone does intentionally. Because if you think about it, even people who smoke, they don't smoke with the intention of getting lung cancer, right?
Nope.
So this is never about blame or shame, but that answer was not sufficient for me. It just happens. And so I go on this quest to figure out how to heal myself. And I was very fortunate that in the very beginning of my journey, I got to hear someone who opened my eyes to a world that I didn't know about, that I had no idea existed. And it forever changed how I would look at medicine, how I would look at health, how I would perceive a healer and what that actually means. And it would forever change me. So, I'm sitting in a lecture hall and this tall, handsome guy with this toothy grin walks on the stage and he introduces himself as a functional medicine physician. Now, at this point, I've been a doctor for nearly 20 years and I'm still cynical. So I'm like, what is this quack talking about? There's no such thing as a functional medicine physician.
Right.
But, I remember that I'm sick and I'm there for a reason. So I kind of check my ego at the door and start to listen. And as it turns out, this man is Mark Hyman, who, in 2016, I didn't know what that meant. But now, he's a 13 or 14 or 15 time New York Times bestselling author. He started the Ultra Wellness Center, which is one of the most renowned functional medicine centers in the world. He was the chairman of the first department of functional medicine, which was at the Cleveland Clinic. Like, he's no slouch. Let's just say that.
He's no quack.
He's no quack.
Right.
And between he and Jeffrey Bland, they really established the functional medicine movement in the context of, we have science too. Here's the science. Like, if you think that your science is indisputable, so is ours.
Yeah.
And so, it was such a different approach, what he was talking about, because what he was talking about was root cause medicine. And what I learned inside of that 2 hours with him would forever change how I practice medicine, how I see the role of a physician in the scope of healing. And granted, I'm an early adopter, but, after listening to him speak for 2 hours, I immediately enrolled in the Institute for Functional Medicine and spent the next 3 years just immersed in the study of functional medicine, because the why matters.
Yeah.
Because cancer isn't an accident. It's not something that just happened to you. Do your genes matter? Yes. But the thing that matters most is your environment. And that's the part that we can control. And it's really important that we ask the why. It's really important that we figure out what is happening with us, because we are perfect machines. Our bodies are perfect machines, and we are meant to function optimally. And it's when we don't that we have to be asking, what are we giving our body that it doesn't need or doesn't want? And what are we not giving our body that it needs and wants? And when you approach medicine that way, you actually help a lot of people, because you help to restore them to where they should be. And so, after the 3 years, I just, despite the fact that I loved surgery and loved being a surgeon and really felt like I was there for people at a critical time in their life, but I knew I wasn't really changing the trajectory of their life. Yes, I was taking them over a bridge from one place to another, but I wasn't getting them to a better place. I was just delaying the inevitable, and I knew I couldn't stay there. And so in 2019, I left. I started Real Health MD, and I did that with the intention to help as many women who wanted my help to recover their health after a breast cancer diagnosis.
Yeah, that's an amazing story. I'm curious, do you think that when you were in that lecture hall with Dr. Hyman, do you think that you would have, what he was saying, his lecture would have landed differently on you had you not been sick?
It's so amazing that you asked that question, and thank you for asking that question. I think there's no way in the world I would have heard him had I not
Yeah.
had my diagnosis.
Yeah.
And I knew in that moment, as soon as what he was saying clicked for me, I knew in that moment why I got sick. I got sick so that I could be in that room on that day listening to him speak. Because without my diagnosis, I would have never been open to it. I would have
Yeah.
never been exposed to it. I would have never had that opportunity. And so that same thing goes for anyone struggling with any diagnosis. If instead of seeing it as a punishment, if instead we can see it as an opportunity, then we have the opportunity to really create something great. And I believe that healing can happen at any age and at any stage.
Yeah.
But the thing that's most important is that we all have to maintain curiosity.
Yeah.
Because if you're not embarrassed by something that you did 6 months ago, and I'm embarrassed of 1,000 things that I did 6 months ago, if you're not embarrassed by something you did 6 months ago, you're not learning.
Yeah.
And unless we continue to keep our minds open and be curious, we're not helping people in the way that we're supposed to. I mean, many of us, we're put here to serve. We
Yeah.
know what our purpose is, but we have to remember that in the service of others, we have to stay curious because things change, people change, information changes, and the truth as you know it changes all the time.
Yeah. Yeah. I love that. I love that you're using the word curious because it is so much about curiosity, right? That leads to our growth, our power to sort of, ask the right questions or just ask any questions
Yeah.
and be curious whether they're about ourselves, about someone else. But in that curiosity is learning and is growth. And I love the example that you used about being embarrassed about something you did 6 months ago, because as we learn and as we grow, we are definitely doing things that we look back on and we're like, oh God, that
Oh
was
my God.
awful.
I have so many cringe moments. I mean,
Yeah.
I actually really want to talk about one of them because
Okay, great. Let's hear it.
when I made the shift over to functional medicine, I still, in my mind, when I trained to be a breast cancer doctor, I was trained by a gentleman named Gordon Schwartz of blessed memory. And Dr. Schwartz was a internationally renowned breast cancer doctor. He was Harvard trained. He was like the big Mahath. And when I came out of fellowship in 2003, Dr. Schwartz taught me three things. He taught me that hormones cause breast cancer. He taught me that the only people that should take hormones are those that absolutely, positively can't live without it. And if you are to prescribe hormones, it should be the smallest dose for the least amount of time. And I went through the majority of my career. And, at this point, I'm a doctor for 22 years. Is that right? And then you add on 5 or 6 for residency and training. So whatever, 28, so 25, 6, 7, 8 years, something like that. All that while, I believed that. I believed that hormones were dangerous. I believed that they caused breast cancer. I believed that I was someone from a breast cancer family and that hormones were never a possibility for me. And then about, I would say 2 or 3 or so years ago, I did not go quietly into my good night. And when I hit menopause, it hit me hard. I mean, the amount of times that I would walk into a room and be like, what the hell did I come in here for? I mean,
Yeah.
I was out to lunch. I remember when I was in high school, I was a cashier. That was my job. I was a cashier at the local deli. I can make change in an instant. Like numbers were just really, really easy for me always. I could do anything in my head. And now I'm like struggling with like simple addition and subtraction.
Yeah.
I was losing my brain. I was snapping at everyone. I'm fighting with my husband. I have no libido. Like I have a tire around my waist that I managed to get to 50 some years old without having belly fat. And all of a
Yeah.
sudden I have a tire around my waist and like all this crazy stuff. And I was talking to a friend of mine. I'm part of a mastermind, and I'm talking to a friend of mine in the mastermind, and I'm telling her about all of this because she prescribes a lot of hormones. And I'm like, Deb, I don't know what to do. I'm losing my mind. I'm going crazy. And she's like, well, why aren't you on hormones? And I said, because hormones cause breast cancer. And she's like, who told you that? And, and at the time, I was producing my first breast cancer summit. I've since done two. And she's like, not only am I going to school you, but I'm coming on your summit and I'm going to talk about all the data. And so I didn't do anything. I waited for her to come on my summit. And she talked about all the data. She talked about the Women's Health Initiative. She completely debunked the whole study. She showed me the retraction paper that was printed in 2017 that no one read. And, and by the end of our interview, we got off the air. I'm like, sign me up. Sign me up. I could not believe how much data there was. And then I read the book called Estrogen Matters by Avram Blooming, and it changed my life. And it changed my patients' lives because when we treat women for breast cancer, if they're not already in menopause, we put the majority of them in menopause and we make it like it's no big deal. Guess what?
It's a big effing deal.
It's a big effing deal. It's a big effing deal. And we are basically telling these women, oh, we're saving your life from breast cancer, which, like, listen, I can debate that as well because we are overdiagnosing out the wazoo, overtreating out the wazoo, putting these women in menopause, taking away the little estrogen that they even have. And we are creating depression, anxiety, dementia, Alzheimer's, osteoporosis, coronary artery disease, cardiovascular disease, cardiac myopathy, arthritis, weakness, sleep disturbance, chronic yeast infections, chronic urinary tract infections, putting people in diapers. I mean, you name it, and that's basically what we're doing to these women. So yay, we cured them of breast cancer. Really? Is this the cure for breast cancer? Because this isn't worth living. And people are so miserable on those anti-hormonal drugs that you know what they do? They take that prescription from their doctors, they smile, say thank you, and they walk out of the office and throw them in the trash.
Yeah.
They don't take them, and they just don't have the conversation with their doctor about it, or they take them and complain how miserable they are. Yeah. And, the things that we don't talk about are that as many women every single year die as a complication of a fracture as do of breast cancer. Women die.
Wait. That's crazy.
Yes. Yes.
I mean,
that's correct.
No one talks about that at all.
That's correct.
I mean, there's no like fracture prevention sites. I mean, so you're saying that.
You know what the fraction prevention sites are? Hormone replacement. Because that's what protects your bones.
I know, but the fact that like no one knows that statistic that
because
just
it's not a sexy cell like breast cancer.
Yeah.
Breast cancer is a sexy cell, and it makes so much money for the system. Yeah. So much money for the system. Between the imaging, the overdiagnosis, and the overtreatment, it makes so much money because when you treat someone for breast cancer, beyond just how much money the breast cancer treatments make for the system, but now they have osteoporosis, they have anxiety, they have depression, they have arthritis, they have elevated cholesterol, they have coronary artery disease. Well, guess what? We got a pill for that.
Yeah.
So
Yeah. There's
instead
a
of
pill for
hormone
it all.
replacement, the polypharmacy is astounding. And that's exactly why those results were released out of the Women's Health Initiative, so that people would stop prescribing hormone replacement and we
Yeah.
could start using all the other drugs.
Yeah.
It is crazy. It is
Crazy.
crazy. And just like one of the principal people involved in the study in the Women's Health Initiative said, it's time for the runaway train of hormone replacement to be over. Well, I'm saying it is time for that runaway train of polypharmacy to be over. Because you
Yeah.
know what happens anytime you start to take a drug. The drug
Yes.
has a side effect, then you have to treat the side effect. So that's another drug that has another side effect that you have to treat the side effect. And that's another drug with another side effect that you then treat.
Yeah.
And it's one after the other. And it's this never ending game of whack-a-mole when all we needed to do was to put people on hormone replacement.
Yeah.
So I
Which
think
is
about
crazy.
all the years that I said, no, 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 hormones cause
Yeah.
cancer. And I cringe. I
Yeah.
cringe when I could have helped so many people have quality of life. And I didn't. I let them suffer.
Well, and I think the important thing in there is too, is that, you know, when you know better, you do better.
For
Right.
sure. For
And it's
sure.
just, that was the story that we were all told, from that study in the late 90s or early 2000s. And
Yeah.
it was the story that we were all told. It was the fear that we were all living in.
Yep.
And it has come to light so many things now, so many reasons why that study was done, why that study was funded, how the results that they put out weren't even accurate, that they're very selective.
Yeah.
And all the new information that we have now as women. So, it's a shame. I talk to women all the time. I know a lot of women are still fearful of taking hormones. I've been on my own journey, as you know. It wasn't until I actually took hormone replacement that I was able to, it was like a switch flipped in my body. I mean, I went 7 years feeling like a shell of a human being. And within a week of taking a very, very low dose hormone replacement, it was like I was a watered flower. It was like I
Yeah.
literally came back to life in days,
Yeah. Yeah.
And it's crazy. And back to the polypharmacy, for those that don't know, that what Jen's talking about is that just is like taking multiple medications, adding to all the things.
Yep.
And, as a nurse and as someone who really grew up in pharma, in the corporate world, I did believe like, oh yeah, we're helping people and we're saving people and we're healing people. And I do believe that drugs have that place, but I do think we're also way over medicating, at patients and people, because we just don't know better. But I feel like we're know better now, that like, unless you really have to take something, you have to really, and you have to understand what is being put in your body and why, and what the side effects are going to be. So, I
mean,
appreciate you bringing that
your point is,
conversation up.
yeah, your point is excellent. We're not throwing the baby out with the bathwater. We're not
Yeah.
saying we're never going to use another, pharmaceutical or prescriptive medicine again. I mean, listen, my kid had strep throat a couple of months ago. You bet your bottom dollar that I put him on antibiotics, because
Right.
I'm not going to have him die of rheumatic fever because I'm like, no antibiotics. Like,
Yeah.
we use things when we need them and when they're appropriate.
Right.
But we need to be asking questions like, how is this helping me? And one of the great examples, I don't know if you saw, is it there's a Zantac lawsuit or a Pepsid lawsuit or one of the acid blockers. They had a huge settlement this week
Oh.
because those drugs, when they were approved, all the acid blocker drugs, they were approved for use over a 2-week period of
I was
time.
going to say 14 weeks, right? Yeah.
2 weeks.
Yeah.
And people are on these medicines for years.
Yeah, I was on mine for 15 years.
Yeah.
15
years. And the
Years.
lawsuit was about that. That's associated with cancer.
Yeah.
Because if you take acid away from the stomach, that's the one thing that the stomach needs, right?
Yeah.
It is supposed to be acidic, and we vilified acid to sell all these medicines. And meanwhile, people are dying because if you don't have acid, first of all, you don't digest your food, so you don't get the nutrient out of your food. You're not able to absorb things like B12 and iron and the things that you're supposed to absorb. And everything that we eat has bacteria, has parasites, has fungus, has, it's unavoidable.
Yeah.
But if you have an acidic stomach, it's going to get killed in the stomach. That's why the acid is there. But if you don't have acid in your stomach because you've been on acid blockers for months or years, which so many people were, those organisms get to survive and cause chronic infections and cause chronic inflammation. And ultimately, that's going to lead to cancers for some people down the line. So, we need to be asking way more questions. If you need something, fine, you need it. But for how long and what is it really doing for me? I had a whole conversation the other day. I was on, I think, someone's podcast or summit, and we were talking about chemotherapeutic drugs and how they're presented to people. So normally what they do is they present people with the relative risk. So they'll tell you, like, you have a 50% increased chance of survival if you take this drug, right? And it's because the survival if you take the drug is 4% versus, or 2%, 4% versus 2% if you don't take the drug, right?
Yeah.
So and they don't talk about absolute benefit, because for the 2% absolute benefit you get with that drug, you also are taking on all the risks of that drug, which are enormous. And they're not talking about that. And then you also have to consider that many times when we're talking about a chemotherapeutic drug, if you die of a heart attack from taking that drug, even though the only reason you took that drug is because you have cancer, your death is not attributed to that cancer. It's attributed to a heart attack, meaning that they're not saying the drug caused it. They're not saying the cancer caused it. They're saying you died of a heart attack and it's unrelated. So now we have all these women dying from treatment, and they're saying, oh, we cured them of breast cancer. Really? Did you really cure them of breast cancer? You killed them with the treatment, but you cured, they're counting them as cures. So those numbers, all those numbers that they give people, they're not real. And it's scary. It's scary.
So let's segue with that, because I obviously follow you on Instagram. I know you. I see what you talk about, and I know you've been talking about this for a while. So I want to make sure we talk about it, about the breast cancer imaging.
Yeah.
Because listen, just like no hormones, don't ever take them. We've been told, like, you have got to get a mammogram. Like for me, I started at 35. My mom died of ovarian cancer. I do not have the BRCA gene, but I started to get screened very early, yearly with the mammograms, right? Now it's the, whatever, 3D mammograms or whatever they're called. Maybe they're
digital
4D.
breast tomosynthesis.
DBT.
Yeah.
Right. But this is, again, the story that we all, as women, have been told that get screened every year. Make sure you get screened. Do yourself breast checks, whatever.
Yeah.
But you have a different
screening saves lives. Screening saves breasts, right?
Yes.
This is what you were told. This is what I was told. And I could die 1,000 deaths at the number of times I have told people to get a mammogram. I could die 1,000 deaths at the young women that I told to get screened. I mean, talking about being embarrassed of things that you've done in the past, this haunts me.
So tell us why. Tell us what
Yeah.
for
Yeah.
those
So
who may not follow you on Instagram,
yeah.
but should. But tell us like what the new information is and why you feel
Yeah,
so strongly about
absolutely.
this.
And the sad part is that the information isn't that new. It's just really, really suppressed because, again, the mammographic screening program is an entry door to a lot of money for the system. I mean, we are doing 37.5 million screening mammograms every single year in this country alone. I'm not talking about around the world, in this country alone. So when the mammographic screening program started in the 1970s, it started with good intention based on this assumption. It assumed that breast cancer growth was both linear and predictable. So a breast cancer would start off small, get to some critical size, at which point it would be more likely to metastasize. So if you could find a breast cancer before it reached that critical size, you could save lives and save breasts, right? Do less mastectomies. And it was a lovely, lovely theory. Really, really logical. Just doesn't happen to be true. Now, there are cancers that that's true for. In that colon cancer, that is true for. You can watch a colon cancer progress in a very stepwise manner, but it's not true for breast. Breast is all biology, and they are what they are from the beginning. So if it's going to be an aggressive process, it's going to be an aggressive process from the very beginning. If it's not going to be an aggressive process, it's also not going to be an aggressive process. And for those women, it almost doesn't matter if you treat them or not, because it's never going to progress to the point where it's going to affect their lives. So when we look at the mammographic screening program, when we look at breast cancer diagnoses, starting in 1999, and I've looked at this data very intimately because I wanted to see both what was happening with hormone replacement, because we precipitously dropped off who got hormone replacement starting in 2003 with the release of the Women's Health Initiative. So 80% of women who were getting hormone replacement stopped getting it, and it wasn't prescribed for new women, right? So it was a fraction that were still using it. And when you look at the curve from 1999 to 2003, it goes up, but just a little. And then you hit 2012. And at 2012, it goes like this. And the reason is we introduced digital breast tomosynthesis onto the scene in 2012. So the original technology, the 2D mammogram, that was approved in safety studies. The 2012 version, the digital breast tomosynthesis, that was grandfathered in. So now we are giving women 2 to 3 times more radiation, and that's for the average woman. If you are dense breasted or large breasted, in order for those x-rays to penetrate the tissue and create an image, they sometimes have to dial that radiation up close to 10 times. So there are some women that are getting 10 times the amount of radiation. So the bottom line is, if you ask any radiologist, does radiation cause cancer? They would say, absolutely. You ask the same radiologist, do mammograms cause cancer? No, they don't. Because we gave it a nice name. We gave it a friendly name. We didn't call it what it is. We didn't call it a breast x-ray. Called it a mammogram, pretty picture of the breast. And all of a sudden it doesn't cause cancer? Come on. So we are literally causing thousands of cancers every year, causing them because of repeated x-ray. And then when you look at the numbers, no matter how many mammograms we do every year, the same exact number of women present with aggressive disease. No matter how many mammograms we do every year, the same exact number of women die of breast cancer every year. We are not impacting the bottom line. We're not impacting it by finding them early. We're not impacting it with our treatments, We are not impacting the bottom line because we're not changing those women that are going to present with aggressive disease. And now we're creating breast cancer for some women that would have never gotten it. And we are identifying these women with breast cancers that don't need treatment, and then we're treating them. So we have thousands and thousands of women every single year who are being overtreated. And when we treat women for breast cancer, as we talked about before, this is not benign. They're losing their brains, they're losing their bones, they're losing their heart, they're losing their gut, they're losing their skin, they're losing their ability to be continent, they're losing their libido, they're losing their relationships. I mean, this is not benign. We are harming people, and all because we decided to screen the population. You cannot take the healthy population, and that's what we're talking about for screening. I'm not talking about women that have lumps in their breast. I'm not talking about people that have findings. That's a diagnostic population. That is totally different. I'm talking about the normal, healthy population. We cannot take the normal, healthy population and expose them to radiation every year. We are hurting them. We are hurting them. And it's immoral. It really is.
Yeah. It's crazy.
It was a very hard conversation to have when there wasn't a solution, because no one wants to hear about a problem unless there's a solution. Because so many people said to me, okay, Jenn, even if that's true, it's the best thing we have right now. And it's hard to argue with that, right?
Yeah.
I mean, I can say that we never need mammogram, in that you can screen with ultrasound and just, assume a minimal risk of missing some things. But now there's QT imaging. So QT uses sound waves. It's transmitted through a water bath. They're circumferential sound waves. They collect 200,000 times more data points than MRI. Wow. And it creates an image with 40 times the resolution of MRI. So it is a true 3D reconstruction of the breast.
Wow.
And it is so this is done without compression, without pain, without radiation. I mean, it will
imagine that.
Yeah. Right. And listen, is this about pain? No, because we are women. We are tough. We can do hard things, especially when they're for the greater good.
Right.
But the mammogram is not the greater good. The only one that benefits is the system. That's it. So if you screen 2,000 women, you will potentially save one life, potentially, maybe, I could even argue that. You will cause 10 women to be treated for breast cancer that didn't need to be treated for breast cancer. 10 women. Are we really doing the right thing when we are treating 10 more people than women that we're helping? No, right? No.
Yeah.
And on the other side of that argument is we're saving breasts. We're finding smaller tumors. We're saving breasts. And it would be nice if that were true, but it's not. Because what happens is, no matter what the size of the tumor, women are so filled with fear when they get the diagnosis that they say, just take them off.
Yeah.
And the doctor
1,000%.
do it.
Yeah.
So our mastectomy rate is not down. It's up. It's up. So we're not saving lives and not saving breasts. What are we doing?
Yeah. Gosh, it's such a great point.
I'm so grateful that this technology is here now for two reasons. First, because it's so far superior and it's safe. And second, because it is the only functional imaging on the market. And what that means is that if we find a lesion, we can bring someone back in a short interval, 60 days, meaningless amount of time, right? At 60 days, we can measure a doubling time. And we know that cancers have a doubling time of less than 100 days. And things that are not cancer or things that are not meaningful have a greater doubling time. So if you have a greater doubling time, we say, see you in a year. and we measure the
Yeah.
doubling time again. And if there's no change, we say, see you in a year. And guess what we're avoiding? Unnecessary biopsies, because 75% of the biopsies that we do are for benign disease.
Yeah.
75%.
And I have never had one, but I have heard that the biopsies are painful
They're horrible.
and horrible.
And
Awful.
even if they aren't painful, the emotional burden of going through the biopsy, first of all, knowing that you have an abnormal study, going
Yeah.
through the biopsy, waiting for the results.
It's
You know,
awful.
I hear people waiting 2 weeks for a biopsy result. I would call my patients the next morning. Like, how do you make someone wait 2 weeks for a biopsy result?
I know,
That
it's
is
insane.
crazy. That's torture.
It
It's
is.
unethical. So the burden, and not to mention that for most women, that although it's covered, the copays for those are very expensive. So
Yeah.
there's a lot of burden there. It's emotional burden, it's financial burden. You have to take time off of work. I mean, it's like, it's not nothing.
No.
And while people are relieved that most of them are benign, what are we doing?
Yeah.
What are we doing biopsying all these people that don't even need a biopsy? So we're saving them from unnecessary biopsies. And more importantly, we're saving them from unnecessary treatment, because we are not putting those people in the system that don't need to be in the system. We are not treating them for breast cancer when they don't need to be treated for breast cancer. And we're saving their hearts and their brains and their bones and their skin and their gut and their libido and everything else.
So let me ask you this. What I know you're in the process of opening these new screening centers.
Yeah.
What is the timeline for opening? Like,
So July 1st, the first one will be open on the East Coast. It's going to be open in the Philadelphia suburbs.
Yay!
And
That's
then,
amazing.
yeah.
Great news.
And then I have plans for 7 more this year. We'll be in Florida. We'll be in New York Metro. Hopefully we'll be in Atlanta, Denver, Boston, all over Texas. There will be a center opening in the Chicago area. There's 3 open in California, 2 in Scottsdale, and we're growing. We're growing
Oh my gosh,
rapidly.
this
So,
is
you know,
so
my-
fabulous.
My goal is to open 50 of these and to make sure that every single woman that wants access to this technology gets access.
Yeah, Jenn, that is just absolutely amazing. And I'm so excited to learn more and hear more about this new technology, because I have been, hearing about the radiation and the mammogram. And, when you know better, you do better.
Yeah.
And we know better now.
Yeah.
So our time is coming to an end, but I want to absolutely make sure that we mention that you just released a #1 best-selling book called The Smart Woman's Guide to Breast Cancer. I'm so excited for you. So happy. I'm sure people can find it on Amazon.
Yes,
Correct?
you can find it on Amazon. And we're launching a new website this week, so it will also be available on my website.
And what is that website?
The website is Real Health MD.
Okay,
And
great.
And also the Perfection Imaging website will open this week, so people will be able to go on and schedule their scans and get going, because the new era is here.
The new era is here. I love it. Dr. Jenn, thank you so much for this conversation. It was so wonderful to have you back on the podcast. You are just so passionate about what you do, but you are truly saving lives. And, I love that you're such a warrior for women. And, everything that you do is trying to make the world a better place. So thank you for everything that you do. Thank you for all this amazing information that you shared with us today, because I know you, I follow you, and I learned even more today. And I'm so excited to see what else there is to come. So excited for these new screening centers, and so excited to read the book. So thank you.
Thank you. Thank you so much for having me. It's always a pleasure to be with you.
Absolutely. All right, guys. Well, make sure you check out Dr. Jenn's new website, realhealthmd.com. And I'll be back next week with another amazing suburban warrior here to share her story. And in the meantime, you can find me on Instagram at Suburban Warrior, also on TikTok and YouTube. And I'll see you again next week. Thanks so much.